Management Services in Columbus, Georgia. I'd like to ask if you have ever had this scenario happen to you before. A CRNA shows up on some cases that you're coding and getting ready to bill for one of your anesthesia clients. It's a name that you've never seen before. So you reach out to your contacts with the client, whether it's the anesthesia group or a facility, and they say to you, "Oh yeah, that's so-and-so. We hired them to work for a week to provide vacation relief for a regular CRNA. Can't you just bill the cases in the regular CRNA's name?" Well, no matter how proactive that you've been with your clients, asking them to give you a heads up on any new staff that's coming through, anesthesia related, this inevitably might happen every now and then, especially when the anesthesia client is struggling to fill summer vacation relief, holiday staffing, etc. But unfortunately, from a compliance perspective, Medicare and most other insurance payers, they do not apply the locum tenens rules to CRNAs when it comes to billing. Anesthesiologists, sure, they're physicians, but the use of modifier Q6 is only to be used when a physician substitutes for another physician. The use of modifier Q6 has been expanded to apply to physical therapists in some scenarios, but for today's discussion, we're focusing on anesthesia care team providers. We recently started billing for an independent CRNA group. They cover 7 surgery centers. They do about 900 to 1,000 cases a month. They shared their upcoming schedule with me for 3 months coming up. And I counted I counted 24 different CRNAs scheduled for a 3-month period. So I asked, why do you have 24 different CRNAs scheduled to cover 7 ASCs or surgery centers? And they said, oh, well, we have a pool of recurring PRN CRNAs that we use. They might work a day here and a day there, or a week here and a week there. So we just draw from that pool as we need to. Well, whether you have a pool of CRNAs that you're using on a recurring PRN basis, or you go the traditional locum tenens route for, say, vacation relief, someone that's away for a while, well, you still need to get these CRNAs enrolled and credentialed with your insurance payers. Even if you have some commercial payers, for example, that you're out of network with, there's more than likely still a process you have to go through that would require that the CRNAs be uploaded into their claims payment system, added to the group roster, or possibly even credentialed, which can take anywhere from 30 to 120 days. So in summary, the locum tenens billing arrangement using modifier Q6 does not apply to CRNAs. Make sure your anesthesia clients give you as much advance notice as possible. Supply your payer credentialing team with all the documents they need to get these CRNAs credentialed or enrolled or otherwise added to your insurance contracts on a reassignment basis. So a little bit about locum tenens not applying to CRNAs. If there's anything we can do to help your group, your anesthesia group or your facility that employs anesthesia care team members with your billing, then please give us a call. Thanks and have a great day.